On any given day, anyone can have a sudden cardiac arrest. Your neighbors, your friends, your family. By learning CPR, you can improve their chances. You can make a difference. You can help save someone's life. CPR is easy to learn, and it could help you save the life of a friend or loved one.
Think we can add a little more to that slide?
Yeah, it's a mess, but it does tell the story.
Let's remove that third bullet.
Let's try this.
Yeah, that works.
Ray? Ray, are you okay? Are you okay? Help! Help! I need help! Jess, phone 911. George, get the AED.
911, what's your emergency?
A man in our office has collapsed. I'm putting the phone on speaker mode.
He's not breathing.
What is your exact location?
2710 Walsh. By the post office, the third floor conference room, we've started CPR.
Make sure you are pushing hard and fast. Count your compressions
1,
out loud
2,
so I can help
3,
you with your
4,
compression rate.
5, 6.
EMS is on the way.
Okay, thanks. 9, 10,
Okay,
11,
just keep the
12,
compressions
13,
going.
14,
Push
15,
hard and fast
16,
in the center of
17,
the chest,
18,
okay?
19,
You're
20,
doing great.
21, 22,
Your
23,
compression rate is
24,
good.
25, 26,
Got the
27,
AED.
28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53,
Stay
54,
clear.
55.
Don't touch him. After the shock, I can take over compressions.
Shock needed. Charging. Stay clear of patient.
Stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Sudden cardiac arrest results from an abnormal heart rhythm, causing the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive, and within minutes, death can occur if the person does not receive immediate life-saving treatment. CPR stands for Cardiopulmonary Resuscitation. This course module will teach you the basics of performing CPR on an adult. You'll learn to recognize when CPR is necessary. You'll learn what steps to follow. You'll learn how to perform CPR on an adult in different situations. And you'll see why providing CPR can be the difference between life and death. By the end of this module, you'll know how to perform adult hands-only CPR, how to use an automated external defibrillator, or AED. You'll also have the opportunity to practice on a mannequin while the video guides you. For the purposes of this course, an adult is anyone who has reached or has already gone through puberty. If there's any question about whether someone has reached puberty, treat that person as an adult. Someone who is responsive is one who moves, speaks, blinks, or otherwise reacts when you tap him or ask him if he's okay. If he doesn't, he's unresponsive. When someone's heart stops beating, blood stops flowing through the person's body. Recognizing sudden cardiac arrest and the need to provide CPR quickly is important. When an emergency occurs, there's a sequence of steps you should follow to determine whether an adult needs CPR. First, make sure the scene is safe. Look for anything nearby that might hurt you. The first step in saving someone's life is to make sure everyone is safe, including you. See if the person is responsive. Tap the person firmly on the shoulder and shout directly to the person, "Are you okay? Are you okay?" If the person doesn't respond, shout out for help.
Help! Help! I need help!
Having someone to assist you can make things easier, so shout for help. Tell someone to phone 911 and tell that person to get an AED.
Jess, phone 911. George, get the AED.
If you're alone and have a cell phone, phone 911 and put it on speaker mode. If no one has come to help you and you don't have a phone nearby, leave the adult to phone 911 and get an AED if available. Return to the adult and use the AED immediately. Check for breathing. If the person is not breathing normally or is only gasping, then he or she needs CPR. Scan the chest to see if it rises and falls. Do this for at least 5 seconds, but no more than 10 seconds.
He's not breathing.
If there is no sign of breathing or the person is only gasping, begin compressions. Now let's take a look at a demonstration of agonal gasps. Gasping may appear forceful or weak and may happen at a slow rate. Let's take a closer look at each of the steps involved in providing CPR.
Help! Help! I need help! Jess, phone 911.
911, what's your emergency?
An important step in hands-only CPR is phoning 911 to bring emergency medical help to the scene. But when should you phone them? And if you're alone, how? When you shout for help, if someone comes, get that person to phone 911 and get an AED. Make sure the person knows just what you want him or her to do. If several people are there, look directly at one of them, make eye contact, and tell the person, you phone 911 and get an AED. If you're alone and have a cell phone, phone 911 and put it on speaker mode. Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher may also tell you how to help the adult until someone with more advanced help arrives and takes over. If no one has come to help and you don't have a phone nearby, leave the adult to phone 911 and get an AED if available. Return to the adult and use the AED immediately. It's also important for you to know how to phone for help from your location. Do you know how to activate the emergency response number in your workplace? For example, is it necessary to dial 9 for an outside line, or is there an internal number to phone that will notify responders who are on site? Also, be aware of your surroundings. Knowing the address of your location will help emergency responders reach you more quickly, and that can greatly improve the chances of saving a life. When you push hard and fast in the center of the person's chest, you pump blood to the brain and heart. Let's look at how to give compressions hard and fast. You'll have a chance to practice in a moment. For now, just watch. First, make sure the person is lying flat on his or her back on a firm, flat surface. Next, move any clothing out of the way. Now, put the heel of one hand on the center of the chest. Place the heel of the other hand on top of the first one, like this. Push hard, straight down, at least 2 inches. And by hard, we mean hard. It's unlikely you'll hurt the person by pressing hard and fast. It's more likely that your compressions won't be hard enough. Try to keep your arms straight and your body centered directly above the person's chest. The correct rate of compressions is 100 to 120 compressions per minute. After each compression, let the person's chest come back up to its normal position. You've just learned one of the most important actions in helping someone survive sudden cardiac arrest, pushing hard and fast in the center of the chest.